rehab or opiate dependency. They said they hurt their shoulder at the gym. And they walk out with a prescription for Vicodin.
Right.
I mean, that's fully informing. Well, I only wrote it for 2 weeks. Okay.
Helps.
I only need one.
So, yeah, definitely the next slide is, build a team. What you need is a team that you can work with. Find some physicians that you can work with and collaborate with. We did have an experience with another local physician, that same scenario with the opiates. I called them and said, we don't want them to have that. And he said, so if they were diabetic and I prescribed insulin, would you be calling me and telling me not to give them the insulin? Yeah. So they're not all receptive when we call. But we need to educate them. We need to educate the physicians. It's just now that they're getting this training in medical school. It's just now that they're talking about it. They do have an awareness now because, they're being practiced.
That's the good thing. I mean, at least if they're becoming aware of it, then maybe down the line things will better.
The DEA is real interested in what they're doing now, so that, that has heightened their awareness. Yeah.
He does her dad mainly. How medication given. Can't get his, 11 o'clock the next time.
Spotlight on
stuff. Yes.
I went to my dentist and I said, I'm going to do this talk and I'm nervous. And my dentist said, I can give you some Ativan. It was that easy. I didn't ask for it. We were just having a conversation. But it's that easy to get things. It's just that easy. So we need to educate them. And, we need to work with them. But build a team that you can work with. Build a team that you can work with and you can share information and work collaboratively with. And then I just finally I took some notes from these 2 areas. And I rushed through. Any other comments or questions?
Well, one thing I wanted to mention also is that a lot of the things people mention at the end is, it's also the approach that Jim has here is treating the pain as a dual diagnosis. Taking the literature of dual diagnosis, most people think of the second diagnosis always has to be a psychological diagnosis. But Jim's approach here is that we take the literature and the experience of dual diagnosis and say the second morbidity can be pain management. So, it brings a different perspective to it.
Just for my benefit, I was hoping to do that earlier when I was talking. I didn't get that across?
You did.
Oh, okay. What do you guys, did I?
Just get it clarified.
Oh, sorry. No, I'm glad, I just want to be sure because, I've read it a million times and, as long as everybody said this was, I cut it way, way down because these topics you could talk about forever. There's so many different aspects to it, So I was hoping to get that across that it was a co-occurring disorder.
Well, no, I know you did. I just reiterated.
I just want to make sure.
You talk about some things that we can look for when we do think that the client is med seeking, and what are things that we kind of watch out for?
China works here to better tomorrow. China, if you need a mother, go to China. China's very nurturing. She's very kind. She's very compassionate. Codependent. And so China will often come to me, oh, my client, just recently she said, my client, her shoulder is in such severe pain. So the way I like to describe it is, do the words and the music go together? And so, we looked at this client and she was moving and talking just like me, but her pain was more than 10 out of 10. It just doesn't jive. So China and I have talked about, observe their behaviors too, just like we do in addiction, because they know what to say. They know what to say. They know what to say to the doctors, but observe what they're doing too. And so we see that. We see our young guys who they play basketball at the gym, and then they get here to the office and they're limping, and they need to go. It's like, well, help me understand that, because I get a report from our staff that you're playing basketball. What happened? And, we try to work with that, but definitely observe their behaviors. But again, like I said, I found that if I challenge them, they'll show me how bad it really is.
You mentioned what they can't have, but can they have, like tramadol and, type, what else is there other than like tramadol?
Well, Lyrica, I think, is that where you were gonna go? Lyrica is the new, medication for fibromyalgia. I mean, if you've seen those commercials, it's like the only antidepressant, I think Cymbalta now too. Those are good. We do a case by case. We did have a gentleman who actually hurt himself, and he had three fractures in his arm. So yeah, and he wasn't abusing opiates, so sure, time limited, narcotic medication is appropriate. We would do that. Like, we're not totally opposed to narcotics. They're very appropriate, and they're wonderful. They're just not meant to be used forever. Any other medications?
Acute pain and chronic pain and everything. So acute pain right after surgery is appropriate, opiate use, just for the actual acute pain after surgery.
Sure.
But then the chronic is when it goes beyond the complex surgery.
But that's where it starts,
That's where
it
you
does
get
start getting
abusive.
tricky. Because
That's where
there's,
it's abusive. But I mean,
Right.
if somebody has surgery, obviously,
Yeah,
your
absolutely.
body goes into shock. So there's a reason for that. But it's
our doctor uses Lyrica, Neurontin, Cymbalta, Motrin. I mean, those drugs are great. Motrin, ibuprofen, Tylenol, they're great analgesics. They work really well. Any other medication?
People do tramadol.
Yeah. Tramadol is one of those kind of in the gray area, and if you read the label, it says if you've had a history of abuse, you probably shouldn't use that.
Well, that's in my house, that's the only thing, I don't allow narcotics, period. So I'll say, okay, but they can have tramadol. But that's as strong as I allow in my house.
You can develop a tolerance and dependency to that. Any other medications you guys are familiar with? Good. Well, we finished early. If there's no other questions.
Thank you.
Thank you.
You know what? I do have a question. I wanted to know if maybe somebody here could kind of outline, had long-term effects of opiate dependence and use.
Somebody else did that.
In terms of, what was her question? What you would see from the outside?
Physical effects,
Yeah. Well, we watched a staff member, where we knew he had a total dependency on drugs, alcohol of all kinds. I mean, there wasn't anything off limits for him. He had a very bad back.